Hi there, my name is Andrew Vandenberg. I'm currently a second year physical therapy student at Campbell University, as well as a licensed athletic trainer. Welcome to my 5-part video series on how to perform VOMS testing and how to prescribe exercises for return to sport afterwards. I hope you enjoy. All right. For the final portion of VOMS, we're doing the visual motion sensitivity test, or otherwise known as the VMST. And this is the most symptom-provoking of all the VOMS testing, which is why it's done last. As you can kind of tell, each of these tests has gotten harder and put more strain on the vestibular system. And so that's why we do this one last, because if we get any positives beforehand, we don't need to progress all the way to this one. This one, you're going to, again, need your metronome. So I'm getting out my metronome. It needs to be set to 50 beats per minute, as opposed to the last one with the VOR being set to 150 beats per minute. It's going to start with the same setup here. So I'm going to have Anna take one of her hands, extend it out all the way. Except I'm actually going to have her turn all the way to her right side because she's using her right arm. If it was her left side, I'd have her do that. And so this time, instead of just moving her head is going to stay still. Her arm is going to stay still. She's still focused on that thumbnail, but now she's rotating her whole body while still focusing on her thumb. And so I'm going to, again, similar to the last step here, I'm going to start the metronome. She's going to notice it's much slower. I'll let her listen. And she's going to move as far as she can one way, then another, to the beat of the metronome. So when she hears the beat, I say just bounce back to the other way. When you hear it again, bounce back to us. So does that make sense, Anna?
Yeah.
Cool. So focus on that thumbnail. And again, I let her hear the metronome. And whenever you'd like, start moving to your left on the beat. And don't stop before. Keep moving the entire duration. And once she gets comfortable, and I'm sure she's not going to fall over or anything like that, I'll take a step to the side. And I'm actually going to watch her eyes as they track. Ideally, what we should see is no movement from the eyes here. So the eyes should be locked on the thumb, and there should be none to very little noticeable movement. It would almost be not noticeable to the naked eye. Again, any sort of abnormalities, you can stop here.
Okay.
Would be the eyes kind of lagging behind. You'll kind of see it almost like catching up, like little blips, and any sort of inability to keep the head straight or the body still on top while they're doing that thing. And again, with any VOMS test, we're going to make sure that we ask symptoms afterwards. So Anna, did you have any headaches?
No.
Any dizziness?
No.
Any nausea?
No.
Any fogginess?
No.
Perfect. So when we're looking at Anna's VMST test, this can be a little bit of a hard one to negotiate. 1, you want to keep the metronome close to them, and 2, you want to make sure that you guard them safely because this is the most straining test for the vestibular system. So you want to make sure that they're not stumbling or falling in any ways. But if you can have your eyes on their eyes, what you'll want to see is their eyes clearly focused on their thumb at all times. And you see Anna does a pretty good job of this. You can't quite capture it very well on video, but sometimes you'll see the eyes slowly lagging behind and then catching back up. And it kind of almost looks like they're ticking slowly and rhythmically. So if you see this slow and rhythmic ticking, that is a sign, a positive of what you can see from the eyes and a sign of vestibular dysfunction there. For the final portion of these VOMS tests, the VMST, you can go a lot of different directions with this. For me, I wanted to make sure that the background was moving and the athlete was moving, but they were still focused on a stationary target. So you can see here in this first example video, I have Anna jumping in place, essentially doing 360 degrees one way and then 360 degrees back. You can see for the second video, I make it a little bit more difficult on her by having her travel down a line here. Now, I think there's lots of different interpretations you can go with this. I think you could even have them running, cutting, and doing all sorts of things while focusing on an object. I gave her the ruler here. You can have them focus on a ball or whatever implement of sport they may be playing. To make this easier, you can have them do small quarter turns and then back to the middle again, or significantly increase the time after landing before jumping again. But those are just some of my thoughts on how to come up with exercises to help improve the visual motion sensitivity test in people with VOMS deficiencies in that testing area.